back to my channel. Parkinson's disease or a PD is a neurodegenerative disorder in which dopamine producing neurons of a brain structures called a substantia nigra are damaged and die over time, leading to a major function is to inhibit unwanted motor activities when a person intends to make a movement. This inhibition as dopaminergic neurons are progressively lost in PD patients. Low level of dopamine make it harder to initiate volunteer movements. The events leading to neuronal cell death are poorly understood by the presence of so-called Lewy bodies in the neurons. Before they die may offer a due and is currently a subject of intense research. Symptoms develop slowly over time. Most prominent are motor problem which includes hand tremor, slow movement, limb rigidity are correctly known as Parkinson. However, Parkinsonism may also caused by a variety of other factors which must be excluded before a person can be diagnosed with PD. Motor related problem may include slurred speech and reduced facial expression in later stages. Non-motor symptoms such as mood and behavior changes, cognitive impairment, and the sleep disturbance may be observed. The cause of Parkinson remains largely unknown but is likely to involve both genetic and environmental factors. There is no cure for PD, but current treatments are effective in managing motor symptoms. Fine line treatment involves medications which aims to increase dopamine level in brain. Dopamine itself cannot cross the blood-brain barrier and is converted into dopamine inside the brain. Levodopa is the most effective of all medication. Because it also produces dopamine elsewhere in the body, its side effects may become serious in the long term. For the reason, levodopa is always administered together with some other drugs that inhibits its action outside the brain. Dopamine agonist, substance that binds to dopamine receptors and mimic the action of dopamine. Another class of drug includes inhibitors of enzymes that break down dopamine for people who do not respond to medication. Next is surgery. May be recommended. The most commonly performed procedure, deep brain stimulation, involves the implantation of device called neurostimulation, which send electrical impulses to the specific part of a brain. By doing so, pill rolling tremors are resting tremors. If a person is rolling a pill between their thumb and index finger. Thank you for watching. Namaskar.